Hello, my name is Teresa Lee, and this is my head-to-toe video assessment video for United States University for the MSN FNP program. Today is June 15th, 2024, and then I'm just going to introduce you to my model or my patient here. Go ahead and state your full name and your date of birth, please.
My name is Abel Navarro Jr. and my age is 37.
Perfect. And what is your date of birth?
My date of birth is 7/15/86.
Perfect. And then just to confirm, you are the one that signed the written consent online?
Yes.
Correct. And then just to confirm also that you are giving verbal consent for me to do the assessment as well as posting it on YouTube as unlisted for both my instructor and any ancillary staff to possibly view for auditing purposes?
Yes.
Perfect. And then I just wanted to let you know also that this is just a mock exam, and this is just for my my program course and learning. So any like abnormal findings that we find, if there are any, you would have to go and follow up with your PCP.
Okay, understood. Thank you.
All right. And then I just wanted to do my verbal attestation that I am following the United States University Code of Conduct, and I'm not receiving any outside help or using any like materials in any way to help me complete the exam. Okay, so I'm gonna go ahead and start with the 360 room scan. Nothing there, and then the TV is off, we don't have any notes, and then here's the ceiling and the floor. Okay, and then in my ears I don't have any like earbuds or AirPods or anything in. And then with the mirror, I'm just showing you that you are placed on a tripod, and then again, the TV is off. Oh, and then I gotta show you my supplies. Okay, so there's everything there. Again, no notes or anything like that. Okay, so I'm just gonna set my timer. Is this all right, so I'm gonna go ahead and get started. Hello, my name is Teresa. I am a family nurse practitioner student with US University. And I'm just going to be completing your head-to-toe assessment today. I'm going to go ahead and wash my hands. Can you tell me your name and your age and date of birth, please?
My name is Abel Navarro. My age is 37 years old. Date of birth is 7/15/86.
Perfect, and 37?
37.
Awesome. And then what is your gender?
I'm a male.
Perfect. And what is your race and nationality as it shows up on your passport?
Mexican American.
Perfect. Okay, and what brings you into the clinic today?
A wellness exam.
Awesome. So patient states he is here for a wellness exam. If he were to come in with a complaint, I would want to complete the HPI workup, which includes onset, location, quality, severity, duration, timing, context, and modifying factors, as well as any associated signs and symptoms. When was the last time you got a annual exam?
3 months ago.
Okay, perfect. Any abnormal findings with that?
No.
Okay. When was your last eye exam or dental exam? And dental exam?
Last eye exam and dental exam were also 3 months ago.
Okay, awesome. Any abnormal findings with those?
No.
Perfect. Okay, have you ever been diagnosed with any chronic illnesses?
No.
Okay, and if he did, I would ask what it was when it was diagnosed, as well as any treatments, current and past. Any history of psychiatric disorders?
No.
Okay, and again, I would ask what it was. If he did, I would ask what, when, and if there were any hospitalizations. And next is, have you ever been diagnosed with any infectious diseases like TB or hepatitis or HIV/AIDS?
No.
Okay. And then do you have any allergies to drugs or foods or environmental factors?
No.
Okay, and if he did, I would ask what it is, the reaction that he gets, and then if he does have any treatment for that. Are you taking any medications, over-the-counter supplements, or prescription?
No.
Okay, and if he did, I would ask for the name, dose, route, and the purpose, as well as the frequency. Next is surgeries. Have you had any past surgeries?
No.
Okay, and if he did, I would ask for what purpose, if he was, or the type of anesthesia that he was under, as well as any complications, and then, yeah, I think that's it for that. Hospitalizations and injuries. Have you had any past injuries or hospitalizations?
No.
Okay, and if he did, again, I would ask for what purpose he was injured or hospitalized, as well as like the treatment, and if he had any complications with the hospitalization. Are you up to date on your childhood immunizations?
Yes.
Perfect. And what about your COVID vaccine?
Yes.
And your flu vaccine?
Yes.
Awesome. Okay, and because he's male, I won't ask about GYN history, but if he were a female, I would ask for last menstrual period, the characteristics, any past pregnancies, live births, and then also asking about menopause if he's that age, but he's not. Okay, so next we're gonna ask about just your sexual history. Are you currently sexually active?
Yes.
Okay, and how many partners are you seeing?
1.
Okay, for how long?
6 months.
Perfect. Have you had any, and what is your sexual preference?
I'm gay.
Okay. And then, have you had any history of STDs or STIs?
No.
Okay. Are you doing anything to protect yourself from STIs?
Condoms.
Perfect. And then obviously no pregnancy plans because you're male,
Yeah.
unless you want to adopt.
Yeah.
Okay, so I think that's it for that. Let's see. Okay, so now I'm gonna move on to your family history. Do you have any siblings?
No.
Okay, and then no children. Your parents, are they alive and in good health?
Yes.
Okay, and how old are they?
My mom is 55.
And no health issues?
No health issues.
Okay, and your dad?
My dad is 58.
Okay,
And
and no health issues?
no health issues.
Perfect. And then for your grandparents on your maternal side, are they alive or deceased?
They're deceased.
Okay, and what did they die of?
I'm not sure natural causes.
Okay, and then what about for your paternal side?
They're deceased.
Okay, and then do you know the reasons why they're deceased?
I think just natural causes as well.
Okay. So I'm gonna just go through a list of health conditions, and you let me know if any of that kind of runs in your family or if anybody had it, okay?
Okay.
So any early vision loss or cataracts?
No.
Okay, heart attacks or high blood pressure?
No.
Asthma or COPD?
No.
Diverticulitis or Crohn's disease?
No.
Osteoporosis
No.
or osteoarthritis?
No.
Any obesity?
No.
Okay, any diabetes?
No.
Any colon or breast cancer?
No.
Down syndrome?
No.
Hemophilia?
No.
Any psychiatric disorders like depression or anxiety?
No.
Okay, and then any substance abuse?
No.
And any allergies to like drugs, foods, or environmental factors?
No.
Okay, and then any stroke or Alzheimer's?
No.
Okay, perfect. So I think I got all of that there. Next, I'm going to move on to your social history. Where were you born?
Los Angeles.
perfect. And we already went over your race and ethnicity as well as your nationality. What's your occupation?
I'm a nurse.
Perfect. Any military history?
No.
Okay, and if you did, I would thank him for his service. What's your marital status?
Single.
Okay, and do you have or you said you have, is that your partner, or just sexual?
Just sexual.
Okay.
Yeah.
Well, that's fun.
Yeah.
And what are your living arrangements like?
I live alone.
Okay, in a home or an apartment?
In a home.
Okay, perfect. And then what is your typical diet like?
I try to eat pretty healthy, so like lean meats, vegetables, mostly high protein, low carb.
Perfect. That's awesome. That's great. And then what about your hydration? Do you drink like 64 to like 84 ounces of water?
Yeah, I would say about there.
Like 6 to 8 glasses a day?
Yeah, 6 to 8 glasses.
Perfect. And then tell me about your exercise routines.
Typically I lift weights maybe about 3 times a week and hot yoga 2 days a week.
Perfect.
Mhm.
That's awesome. It's very balanced.
Yeah.
Any eating disorders?
No.
Okay. And then any laxative use?
No.
Okay. And tell me about your caffeine consumption.
I don't drink caffeine.
Perfect. Okay. And then any past or current history of like tobacco use, vaping, or drug use?
No.
Okay. And then any alcohol consumption?
No.
Okay. And then can you just describe your overall like emotional, mental health to me?
I'm honestly really happy.
Okay.
Yeah,
Awesome.
I have no, like, I don't feel like I'm stressed out. I don't feel anything. I'm just happy.
Great.
Yeah.
So no life stressors.
No.
Is what we like to hear.
Yeah.
Okay. So can you describe like your sleep patterns to me?
I get about 8 hours of sleep a night.
Awesome. And you sleep through the whole night?
Yeah, I usually just sleep through the whole night.
Beautiful.
Yeah.
As far as hobbies, do you have any?
I like to play soccer.
Ooh, that's fun.
Yeah.
Great. And then do you participate in any like alternative health practices like acupuncture or cupping or anything?
No.
Okay. And then as far as safety, do you wear seatbelts when you're driving?
Yes.
Or in the car, period?
Yes.
Any history of like sexual or physical abuse?
No.
Okay. Do you keep guns in the house?
No.
Okay. Perfect. All right, so I'm gonna go over just a review of systems now. I'm just gonna ask you a bunch of questions and you just let me know if you have those symptoms or any similar symptoms, okay? So just in general, how would you describe your overall health?
Healthy.
Good, okay. Any fever, chills?
No.
Any unexplained weight loss or fatigue?
No.
Okay. Any changes in vision or decreased vision?
No.
Any floaters or
No.
like cloudiness in your vision?
No.
Okay. Any eye pain?
No.
All right. Moving on to the nose. Any like changes or difficulty in smelling?
No.
Okay. Any pain in your nostrils or your nose?
No.
All right. And then any difficulty or changes in hearing?
No.
Any pain in your ear?
No.
Any discharge?
No.
Okay. Any sore throat?
No.
Lesions or sores in your mouth?
No.
Difficulty eating or swallowing?
No.
Difficulty chewing your food?
No.
Perfect. Any chest pain or heart palpitations?
No.
Any like skip beats or extra beats?
No.
Okay. Any shortness of breath with or without exertion?
No.
All right. Any difficulty breathing or coughing?
No.
With GI, any or can you tell me about your BMs?
Daily.
So quality and quantity. Perfect.
Yeah, daily. Once a day.
Okay. Perfect. And then any constipation or diarrhea?
No.
Any blood in the stool or
No.
in the stool? Any painful urination
No.
or burning?
No.
Any discharge in
No.
the genitalia? Perfect. Any dizziness or unsteady gait?
No.
Unilateral weakness?
No.
Okay. Any like pins and needles in your feet and hands?
No.
Fingers? Okay. Any joint pain or muscle pain? Any joint pain or weakness?
No.
Okay. Do you have any like cold or hot intolerance?
No.
Okay. Any changes in hair loss or hair growth?
No.
Any feelings of like feeling down or helpless, anxiety?
No.
All right. And then any allergies, or do you ever get like sore throat or get like hay fever during
No.
the seasons? Okay, perfect. And then skin, do you have any changes, just as far as like rashes or lesions or any new like nodules that?
No.
Okay, and if he was female, I'd ask about breast tissue changes. All right, well, I think that we can get started with our physical exam. So just overall, patient is responsive, he is awake and alert. Can you tell me what the date is today?
The date is June 15, 2024.
Okay, and where are you?
I am at the clinic.
Perfect, and he stated his name and the purpose earlier, so he is alert and oriented ×4. Just looking at him, he's sitting upright with good posture. He is well groomed and appropriately dressed with no odors. He is in no signs of acute distress. Respirations are even and unlabored, pleasant affect. How's your mood today?
Good.
Perfect. So he's in a good mood. Okay. And then just overall with skin, patient's skin is nicely hydrated. I don't see any dryness or flaking. His hair is evenly distributed. I don't see any lesions or rashes, no nodules. If I did see any like papules or pustules or macules that are suspicious for like a tumor or a nevi, that is malignant, I would use the ABCDE method and assess the asymmetry, border irregularity, color variation, diameters greater than 6 millimeters, and evolution over time. I'm gonna go ahead and wash my hands and then put my gloves on before I start touching him. So again, overall skin is warm, dry, and intact. I don't see any redness, no edema, no facial swelling, no facial asymmetry. I'm gonna go ahead and start palpating. Head is normal cephalic and atraumatic. I don't feel any depressions, nodules, or cysts. Any pain or tenderness while I'm palpating?
No.
Perfect, and then I'm gonna go ahead and palpate your temporal artery there. It is 2+, normal, non-bounding. And then I'm going to palpate for his temporal mandibular joint. Go ahead and open your mouth and close, perfect. And that movement is smooth with no clicking. Next, I'm going to check his trigeminal nerve, which is cranial nerve 5. So testing motor, go ahead and open your mouth against my resistance, perfect. And that was normal there, movement was smooth. I'm gonna go ahead and test sensory, so I'm gonna have you close your eyes and you let me know if you feel sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Perfect. He was correct there, so all branches of the trigeminal nerve is intact. Next, I'm going to test his cranial nerve 7, which is the facial nerve. So go ahead and raise your eyebrows for me. Okay, and then puff out your cheeks. And then smile real big for me. Perfect. So up top, his eyebrows raised evenly and symmetrically, as well as the facial wrinkles were also even and symmetric, and he was able to perform it without any issues. And then again, in his lower facial nerve, movements were also smooth and equal bilaterally. Okay, so next I'm going to inspect his eyes, I'm gonna palpate actually his frontal sinuses and then his maxillary. Any pain or tenderness there?
No.
Perfect, and I don't feel any nodules or masses there. Next, I'm just going to check your, I'm gonna inspect your eyes. So I'm just gonna pull down here on his conjunctivae. And then up top, and his conjunctiva are pink and moist. I don't see any exudates, no hemorrhaging. Looking at his sclera is white, non-icteric. And then his cornea and lens are opaque with no with no cloudiness. And then pupils do appear, or iris and pupils do appear to be equal and round. And then just hopping back to his skin real quick, I don't see that he has any signs of like jaundice or cyanosis or pallor. Okay. And then next I'm going to test his cranial nerve 2, which is the optic nerve. So I'm gonna have you, we're gonna read the Snellen chart. Normally in clinic it would be on the wall at 20 feet away, or we would use 2 arms lengths, but for the video we're just gonna be pretty close here so I don't step out of frame. So you are gonna use your palm and cover up your left eye and then read the lowest line that you could read.
LTFPH.
Perfect, and then go ahead and switch eyes.
LTFPH.
Perfect, and that was 2020 and 2020. And then with both eyes, go ahead.
LTFPH.
All right, so with both eyes, he had 20/20 vision. Next, I'm going to test his his pupillary reaction. So just with a pen light, I'm going to shine it in his eyes, and I'm looking for constriction to both direct light and consensual. So go ahead and look straight ahead. And I did see constriction with direct light, and I'm going to do it again and look at the opposite eye. And then I do see pupil constriction with consensual light. All right, and I'm going to test accommodation. Go ahead and look at my pen light, and then look at something in the distance, and then back at my pen light. Perfect, and I do see that his pupils constrict and dilate with the accommodation. So he does have perla, which is pupils are equal, round, and reactive to light and accommodation. Next, I'm gonna have you just follow my pen light, and I'm gonna check your extraocular motors. So we're gonna start with cranial nerve, or we're gonna test cranial nerves 3, 4, and 6, which are the ocular motor, trochlear, and the abducens. Okay, so you're just gonna follow with your eyes, and this is ocular motor, abducens, ocular motor, abducens, ocular motor, and then the trochlear. Perfect. So that was all intact there. Next, I'm going to use my my otoscope here, ophthalmoscope, to check for the red reflex and to just check the inside of his eyes. So with safety here, I'm going to come in at 15 degrees, about 15 inches away. I'm going to use my left-handed brace and right hand to right eye. I'm going to locate the red reflex and then come in. So you're just going to look straight ahead. Okay, so I do visualize the red reflex, and then I am able to visualize the optic disc, which is a yellowish to orange cream color. I am able to visualize that the disc to cup ratio is 3:1. I did see arteries were lighter and brighter and smaller than the veins that were larger and deeper in color, as well as non-reflected to light. And then I was able to appreciate the macula lateral to the disc, and then the fovea within the macula. All right, and then I would repeat the same on the other side. So left hand to left eye, and then again I'm going to use my hand to brace and then come in at 15 degrees. And coming in, I do locate the red reflex, and then I don't see, or I see the same findings as the other side. And then I also forgot to mention that findings are no like cotton wool spots or any AV nicking. Okay. So that was it for the eye exam. Next, I'm going to check his nose. So this would be the olfactory nerve. So just inspection first. His nose I can see is midline with no deviations. I don't see any redness, swelling, or any deformities that are visible. Next, I'm going to have you go ahead and plug one nose, or one side of your nose, and then breathe in. Perfect, and he was able to perform that. Go ahead and cover up the other side and breathe in. Perfect. So the nares are patent, and there are no obstructions that I could see. Okay, now go ahead and close your eyes, and then I'm going to just test your sense of smell. Again, this is olfactory. Go ahead and plug one side of your nose, and then go ahead and breathe in, and then let me know what you smell.
Eucalyptus.
Perfect. And now we're gonna repeat this for the other side. Go ahead and breathe in. And what do you smell?
Cinnamon.
Perfect. All right, so he did get that correct. So his olfactory nerve is intact. Next, I'm going to check his ears for, actually I'm going to visualize inside. So I should have done this first, and then I do have a new cover on there. Okay, so coming in, I am using the appropriate size for his nose, so I'm just going to have you tilt your head upwards, and then coming in slowly, I'm gonna go midline. I don't see any obstructions, I don't see any nasal drainage, no polyps, no deviations, and no signs of inflammation or infection. And then I'm gonna come on the other side and then do the same. Okay, go ahead and tilt up, perfect. And then I do have the same findings as the other side. Okay, so now I'm gonna check his ears. So through inspection, I don't see any signs of infection, no redness, no swelling, no asymmetry. His ears do line up equal to each other. I'm gonna go ahead and tug on the pinea here, and then the lobules, and then also the tragus on both sides. Any pain or tenderness there?
No.
Perfect. And then just external inspection, I don't see any obstructions or signs of inflammation in his external canal. Next, I'm gonna go ahead and change out the cover on this, and then check his ears. Okay, so again, coming in just slowly, I'm gonna tug up and back on his pinea, and then just against the medial aspect of his ear canal here, I don't see any obstructions, no signs of inflammation, and now I'm gonna come in a little bit deeper, and I do visualize the tympanic membrane. It is a pearly gray, non-bulging. I am able to visualize the handle of the malleus and the manubrium, and then also the pars flaccida superiorly and the pars tensa. And then again, I'm gonna do this on the other side. I'm gonna come in, pull up and back with the pinea, and then I do have the same findings there. And then I forgot on the other side, I did visualize the cone of light. That was on his right side, and the cone of light is 5 o'clock. And then on his left side here, the cone of light is at 7 o'clock. All right. So that concludes, I'm gonna do a few tests for your cranial nerve 8, which is the acoustic. So I'm gonna start with a whisper test. I'm gonna just be behind you about 2 feet. Okay, now go ahead and cover up your left ear, cover the tragus, perfect. And then I'm just going to whisper 3 words, and then you're just gonna repeat them.
384.
Perfect, and then go ahead and do it on this side.
EBT.
Perfect. So he was able to recite that correctly. Next, I'm going to perform the Weber test. So I'm going to use this tuning fork. I'm going to place it in the middle of your head, or the top of your head, and then you let me know if you hear it on both sides or just one.
I heard on both sides.
Perfect, and that is a normal finding. Next, we're going to do the Ryan test, which I'm going to place it on your mastoid bone. You let me know if you, or when you do hear it, when you can't hear it anymore, and then I'm going to move it and let me know if you still hear it. Can you hear that?
Yes.
Tell me when you can.
I can hear it.
Okay, can you still hear it now?
Yes.
Perfect. And then I'm going to repeat that on the other side. Can you hear that?
Yes.
Tell me when you can't.
I can't hear anymore.
Now can you?
Yes.
Yes. Perfect. So those are normal findings, which means that air conduction is greater than bone conduction, and that is what we want to find. Next, I'm going to inspect your mouth and the lips. So lips are intact. I don't see any signs of inflammation or redness, no cuts. Go ahead and open your mouth for me. I'm gonna use my pen light here. I do visualize the oral, the buccal mucosa, and the soft and hard palate. I am able to visualize his tonsils. They are a 2+ grading. Go ahead and say ah.
Ah.
Perfect. And the uvula does raise midline along with the soft palate when he does say ah. Go ahead and stick out your tongue for me. Perfect. And then his tongue I can see is midline. Normally I would do a gag reflex to test cranial nerves 9 and 10, which are the glossopharyngeal and the vagus nerve. Go ahead and swallow for me. Perfect. And patient is able to once say ah, swallow, and then the gag reflex. So cranial nerves 9 and 10 are intact. Go ahead and open your mouth again. Just visualizing a little more. Go ahead and raise your tongue. Perfect. So I do see that his salivary ducts are patent and intact. I don't see any signs of inflammation. Again, the mucosal or the mucosa in there is pink and moist. I don't see any dental caries, and his gingiva are also free of any signs of inflammation. All right, so next I'm going to test cranial nerve 12. So go ahead and press your tongue against my resistance here. Perfect. And then the other side. Beautiful. And so he was able to perform that without any difficulty. And that is the hypoglossal nerve. Next, I'm going to test his spinal accessory nerve, which is cranial nerve 11. So this is trapezius strength. Go ahead and shrug up. Perfect. And then go ahead and turn your head against my resistance and turn against my resistance. Perfect. Next, I'm going to palpate for his lymph nodes. So here is his preauricular, postauricular, occipital, submandibular, submental, his anterior clavicle, posterior clavicle, and then his supraclavicular lymph nodes. And I don't feel any no like enlargement of the lymph nodes, and no hard, they're not hard, they are soft, and I'm not really able to feel them, which is a normal finding. Okay, so next I'm going to just visualize the neck and the trachea. I see that his neck, there's no redness, no swelling, no asymmetry. I can see that his trachea is midline. Go ahead and swallow for me. Perfect. And his thyroid does raise and fall with swallowing. I'm just gonna palpate for his landmarks here. So I feel the thyroid cartilage, the cricoid cartilage, and then the thymus, or the thyroid gland there, and I don't see any goiters present. Next, I'm going to palpate from the back. Any pain or tenderness here?
No.
Perfect. And then go ahead and swallow for me. Perfect. And I still am able to feel that thyroid moving up and down, and that is a normal finding. Okay. So next I'm going to move on just to your lung and thorax. Visualizing I can see that his, in clinic, again, his shirt would actually be off so that I can visualize it. But for modesty purposes, we're gonna keep his shirt on. So just overall inspection, I see that his chest does rise and fall evenly and symmetrically. I don't see any respiratory excursions or any retractions or accessory muscle use. His looking tangentially, his anterior to posterior transverse ratio is 1 to 2. And then 1 to 2. I don't see any pectus carinatum or pectus excavatum. I'm gonna go ahead and palpate his costochondral for tenderness. Any pain or tenderness there?
No.
Perfect. And then intercostal spaces, any pain or tenderness?
No.
Okay, I'm gonna do the same to the back here. Any pain or tenderness in
No.
your spine? Perfect. And then the intercostal spaces. Any pain or tenderness?
No.
Perfect. And both anteriorly and posteriorly, I was not able to feel any masses, nodules, or cysts, or crepitus. Okay, so I'm gonna start now with respiratory excursion. So placing my thumbs at T10 here, go ahead and take a deep breath in and out. Perfect, and my hands did raise and fall, and that was about 3 centimeter expansion, which is within normal range of the 3 to 5. Next, I'm gonna test for tactile fremitus. So each time I move my hands, just go ahead and say 99.
99, 99, 99, 99, 99, 99, 99.
Perfect. And I did feel even and symmetrical vibrations there, and that is normal. Next, I'm going to percuss my middle distal interphalangeal joint here, starting in the apices, and I am percussing for resonance in the intercostal spaces and avoiding the scapula there. So coming down, and then I'm also doing it laterally, and then comparing to the two sides. It was resonance throughout, and then even and symmetrical on both sides. Next, I'm going to go ahead and auscultate. Actually, I'm going to percuss for diaphragmatic excursion. So I'm going to have you take a deep breath in and hold it, and then I'm going to percuss until I hear resonance to dole, and then I'm going to mark it. Here, and then go ahead and breathe out all the way and hold it. And then I'm going to percuss now inferiorly to from tympany to dullness. Perfect. And then I'm going to mark it there. And then I'm going to go ahead and measure that out, and that is about 3.5 centimeters, which is within normal range, as the normal range is 3.5 to 5 centimeters. And then I would repeat that on the other side and then compare the findings. All right, now I'm going to go to the front. Again, I already did my inspection of the anterior chest, so I'm going to palpate for any heaves or no, I'm not doing that yet. I'm actually going to do respiratory excursion from the front. So again, my thumbs at T10, go ahead and breathe in and out. Perfect, and then my hands did rise and fall symmetrically and evenly at about 3 centimeters. Next, I'm going to test tactile fremitus. So just say 99 every time. I move my ulnar surfaces.
99, 99, 99, 99, 99, 99.
Perfect. So anteriorly and then laterally, the vibrations were even and symmetrical, and that is a normal finding. Next, I'm going to auscultate his lung sounds. Okay, I'm going to start in the apices of his lungs here, and then just take a deep breath every time I move my stethoscope. And I am looking for any wheezes, crackles, rhonchi, or any adventitious breath sounds. And I am moving a little bit faster here just for the video, but I'm going to compare laterally as well. Perfect, and then I did miss this on the back side, so I'm going to go ahead and do it posteriorly. So again, starting in the apices, deep breath, and I'm moving in a ladder-like fashion to be able to compare the sounds on each side. And again, listening for wheezing, stridor, rhonchi, rails, any adventitious sounds. Perfect. And I did not hear any of that, which is normal findings. Okay, so next we are going to move on to your cardiovascular exam. Just visually looking, I don't see any precordial impulses. I'm not able to visualize his apical impulse, which that is a normal finding. And then I'm gonna, with the balls of my hands, feel for any thrills, and then with my finger pads, feel for any lifts in the heart listening areas, and that is the aortic, pulmonic, Erb's point, tricuspid, and then the mitral. And then this will apply for my future exams in the areas, but aortic is the second intercostal space at the right sternal border. Pulmonic is second intercostal space at the left sternal border. Erb's point is third intercostal space at the left sternal border. Tricuspid is fourth intercostal space at the left sternal border, and then we've got our mitral, which is the fifth intercostal space at the midclavicular line. While I'm here, I can also palpate for the apical impulse, and I do feel that it is a brisk tapping, and I don't feel any abnormal like beats or palpitations. Okay. Next, I'm going to just palpate for your carotid arteries in one at a time, and that is 2+ non-bounding, and no threading, normal again 2+. And then I compare that bilaterally, and then I'm gonna go ahead and just auscultate your carotids while I'm there. Go ahead and take a breath in and hold it. Perfect. All right, and I had him hold his breath so that his breath sounds don't mask his carotid pulses, and I did not hear any bruits. All right, next I'm going to go ahead and auscultate the listening areas. Again, the aortic, pulmonic, Erb's point, tricuspid, and the mitral. And I'm gonna listen with the diaphragm and the bell of my stethoscope here. So I'm in the pulmonic, Erb's point, tricuspid, and mitral. Awesome, and I did not hear any murmurs, clicks, or friction rubs. Okay, so next I'm gonna have you go ahead and lie down. We're gonna be at 30 degrees here, head of bed, and then I'm just gonna set this under your legs for comfort. Awesome. Okay, and I'll give you a little blanket for comfort. Okay, so now that he is at 30 degrees head of bed, I'm gonna have you turn your head all the way to the left, and now I'm visualizing and assessing his jugular venous pressure. I do visualize the highest point of oscillation, and we're not gonna measure it out now, but that is a normal finding to be able to visualize that. Next, I'm going to go ahead and auscultate the areas of the heart listening areas. So again, the APE-TM, and again, with the bell and the diaphragm of my stethoscope, I'm listening for any murmurs, clicks, or friction rubs. And then the aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, so I, again, did not hear any murmurs, clicks, or friction rubs. So next I'm going to start my abdominal assessment. Just looking at his abdomen and inspection, again, normally his shirt would be off, but his abdomen is flat. I don't see any redness, no inflammation. It is symmetric. I don't see any nodule cysts or any like lesions or anything that are suspicious. I don't see any pulsations either, and no pulsatile like masses. I'm going to start with just auscultation of the quadrants, and each time I'm dealing with his abdomen here, I'm gonna start in the right lower quadrant, then move up to right upper quadrant, left upper quadrant, then left lower quadrant. Okay, and I'm currently listening for bowel sounds. Okay, so right lower, right upper, left upper, and then left lower. And I did hear normal active bowel sounds, which is a normal finding. While I have my stethoscope here, I'm gonna go ahead and listen for his abdominal artery, or his abdominal aorta, and that is in the epigastrium, slightly to the left. And I don't hear any bruits. Next, I'm gonna listen to his his renal arteries, so left and right, no bruits heard. His iliac arteries left right and then left. No bruise heard. And then his femoral, again, best heard skin to skin, but for modesty, we're gonna go ahead and leave his clothes on. So femoral arteries, I don't hear any bruise bilaterally. Next, I'm going to start percussion. So I'm gonna go ahead and percuss each area of his quadrants, and again, percussing my middle distal interphalangeal joint, and then I am percussing for tympani, as that is a normal finding. Next, so I percuss in his right lower, right upper quadrant, left upper quadrant, then left lower, and again, tympani in all quadrants. Next, I'm going to go ahead and percuss for his liver span. So I'm going to percuss from the bottom of his right upper quadrant, from tympani until dole. Perfect, and I'm going to go ahead and mark that out here. And then again, at the mid-clavicular line, on his right side, I am going to percuss at about his fifth intercostal space, and I'm just going to percuss down from resonance until dole. Perfect, and I do hear that there. I'm going to go ahead and mark it and then measure that out, and that is about 6 centimeters, which is a normal finding, as your normal finding is a 6 to 12 centimeter liver span. Next, I'm going to percuss for his spleen, which is at the left, slightly left of the mid-clavicular line on his left side here, and I'm just going to percuss up until I hear dullness, which I don't hear anything there, and it is a normal finding not to be able to percuss for the spleen. Next, I'm going to start with palpation. So I'm going to start with light palpation first. Let me know if you feel any pain or tenderness. Perfect. And going through my quadrants here, I didn't feel any nodules or masses. Next, I'm going to do my deeper palpation. Let me know if you feel any pain or tenderness. Anything?
No.
Perfect. All right, and again, I don't feel any masses or nodules or anything like that. Next, I'm going to palpate for his liver. So go ahead and take a deep breath in and hold it. I'm going right under his rib cage here. And palpating inwards, and I am able to feel the smooth edge of the liver there. I don't feel any nodules or masses, which is a normal finding. Next, I'm going to go ahead and palpate for his spleen. Again, left of the midclavicular line here. Go ahead and take a deep breath in and hold. And again, right under his rib cage, I'm palpating inwards, and I'm not able to feel the spleen, which is a normal finding. Next, I'm going to palpate for his kidneys. So a little sandwich method here. I'm just going to press inwards of each other, and I'm not able to feel his kidneys there. Any pain or tenderness?
No.
Perfect. And that is a normal finding not to be able to palpate the kidneys. Next, I'm going to palpate his abdominal aorta. So palpating here in the epigastrium, I can feel that his pulsation width is about 2 to 3 centimeters, and that is a normal finding. I don't feel any pulsatile masses. Next, I'm going to palpate his femoral arteries. Again, should be under clothing, but palpating here. I do feel that his femoral arteries are non-bounding 2+ and regular rhythm. Since I'm here, I'm going to go ahead and palpate for his inguinal lymph nodes. And again, I don't feel any hardening of the lymph nodes. I'm not able to feel for them, and that is a normal finding. Any pain or tenderness when I was palpating?
No.
Perfect. Okay, now go ahead and sit up for me, and then you're going to face that way. And now I'm testing for CVA tenderness, so I'm just going to place my hands here at T12, and so mid-scapular, I'm just going to strike my hands here. Any pain or tenderness?
No.
Perfect. And I did that bilaterally, no pain or tenderness, which indicates no kidney injury or inflammation there. All right, so now I'm going to go ahead and just inspect his spine here, and then doing my inspection and palpation. His spine's sitting. I don't see any like cervical lordosis, kyphosis, or scoliosis. Any pain while I was palpating?
No.
Perfect. So I'm actually gonna have you stand over here now. And then you're gonna face the camera there. And then go ahead and flex forward, bend all the way down. So he does bend at 90 degrees, and I'm gonna palpate here, just looking for any scoliosis, any pain or tenderness.
No.
Perfect. Okay, go ahead and stand up. And I did not see any spinal deviations. I didn't feel any masses or nodules or anything like that. Before we start spinal range of motion, I'm just gonna do some cervical range of motion before I forget. So go ahead and flex your head downwards and then hyperextend. Perfect. And then lateral rotation to the right and then left, and then lateral flexion to the left and then right. Perfect. So he was able to perform that smoothly without any difficulty, and he had full range of motion. Next, we're gonna do spinal range of motion, as well as thoracic and lumbar. So he already flexed forward. Now go ahead and hyperextend backwards. Perfect. And then we're gonna do lateral flexion, and then lateral rotations. Perfect. And he was able to perform that smoothly without difficulty, with full range of motion. Next, I'm gonna go ahead and I'm gonna have you face me this way. I'm just going to inspect his shoulders, elbows, wrists, and fingers. I can see that the skin, I don't see any redness, swelling, deformities, or muscle atrophy. I'm gonna go ahead and palpate his inner phalangeals here, his distal and proximal inner phalanges, and then his metacarpals and his carpals are all, do you have any pain or tenderness when I am palpating? Perfect. And I don't feel any nodules or cysts. His skin is warm and dry. Testing capillary refill while I'm here. It is all less than 3 seconds, which is a normal finding. Okay, and then I'm gonna keep palpating up. Any pain or tenderness?
No.
Perfect. And in the elbows, I'm palpating the olecranon process, as well as the lateral epicondyle and the medial epicondyle. Any pain or tenderness there?
No.
Perfect. And I don't feel any inflammation or nodules or cysts there. Okay, I'm gonna keep palpating upwards. Any pain or tenderness?
No.
Perfect. And now in the shoulders, I don't feel any like nodules or cysts. I'm gonna go ahead and palpate his axillary lymph nodes, and I'm just gonna come in here into his axilla. Any pain or tenderness?
No.
Perfect. And I don't feel any enlarged lymph nodes or any hardening of the lymph nodes. And I'm gonna repeat that on the other side. Any pain or tenderness?
No.
Perfect. And then I'm gonna go ahead and palpate his epitrochlear lymph nodes right in here. Any pain or tenderness?
No.
Perfect. And I don't feel any hardening of the lymph nodes, and they are pea-sized, which is a normal finding. Next, I'm just gonna palpate his radial pulses here, and they are non-bounding, regular rhythm, and 2+. Okay, next we're gonna test range of motion. So I'm gonna have you go ahead and shrug your shoulders up. Perfect. We're gonna do go ahead and fully extend upwards, and then flexion backwards. Perfect. And then we're gonna do, this is abduction, and then adduction right across your midline. Perfect. And then other side, right across midline. And he was able to perform that smoothly and without any difficulty, and he had full range of motion. And then I'm gonna have you put your arms up like this and then press up against my resistance. Perfect. So he does have 5 out of 5 strength as far as shoulder strength. Next, we're going to perform elbow extension and then flexion. Perfect. And then pronation and then supination. Perfect. And then go ahead and put your arms up like this, and then you're gonna pull against my resistance and then push against my resistance. Perfect. And he does have 5 out of 5 strength in his biceps and triceps. Next, I'm gonna test your wrists. So go ahead and flex downwards and then extend upwards. and then we're gonna do radial deviation and then ulnar deviation. Perfect. And he does have full range of motion there, able to perform smoothly and without any difficulty. Next, I'm gonna have you just press up against my hands. Perfect. And 5 out of 5 strength there in his wrists. Next, we're gonna test your fingers. So go ahead and flex downwards or 90 degrees, and then hyperextend upwards, and then abduction and then adduction. Perfect. And then go ahead and separate your fingers against my resistance, and then try to pull them together against my resistance. Beautiful. And then go ahead and squeeze my hands or my fingers. Perfect. 5 out of 5 strength there in his fingers, and then also hand grip, which is a normal finding. Shoulders, I forgot to test external and internal rotation. So this, go ahead and put your arms up like this. This is external rotation, and then internal rotation. Perfect. And he was able to perform that again with full range of motion. Next, I'm going to test your deep tendon reflexes. So you can go ahead and take a seat if you'd like. I'm going to go ahead and test your brachial deep tendon reflexes first. Perfect. And then brachioradialis. Perfect. And then I'm going to go ahead and test his triceps. Beautiful. And then same on this side, his brachioradialis, and then again triceps. Beautiful. Okay, and reflexes were 2+, equal bilaterally, and performed without any difficulty. Next, I'm going to hit. So go ahead and stand up for me. Sorry. So we're gonna go ahead and test. So flexion, I'm gonna have you. I'm gonna have you kick forward for flexion, and then extend backwards. Perfect. And then you're going to abduct out, and then adduct in. Beautiful. And then go ahead and do that on the other side. So kick out, extension, or flexion, extension, abduction, and then adduction. Beautiful. And again, full range of motion, and perform smoothly without any difficulty. Next, we're gonna test the knees. So go ahead and flex upwards, and then extend them out. Beautiful. And then internal rotation, and then external rotation. Perfect. So go ahead and take a seat. I'm gonna go ahead and test your hip strength. So pull your knee up against me. Perfect. And up, and then down. Perfect. And down. And then I'm gonna go ahead and test knee strength here. So go ahead and kick your foot out, or your leg out against my resistance, and kick it out, and then pull in and pull in. Perfect. So hip strength and knee strength are both 5 out of 5. Did you have any pain or tenderness when you were doing those? Perfect. Next, I'm going to test your feet. So you're gonna do dorsiflexion first, plantar flexion, and then internal rotation, and then external rotation. Perfect. And then your toes, can you flex them upwards? And then, point them downwards, curl them, and that is flexion. Next, I'm gonna test your foot strength. So go ahead and press your feet up against my resistance, and then press down. Beautiful. And then last, I'm going to just check your, I think I did 55 minutes on there. I'm gonna test your patellar reflexes here. Perfect. Deep tendon, and then Achilles. Perfect. And then I'm going to lift your leg up, and we're going to do Babinski, and his toes curl downwards, and that is a normal finding, and curls downward, that's a normal finding. And deep tendon reflexes were 2+ and performed without any difficulty. All right, so lastly, I'm going to have you go ahead and I'm gonna do your sensory for all areas. I forgot to do your upper and lower. So go ahead and close your eyes, and then 3 on each extremity. Go ahead and tell me what you feel.
Dull, sharp, sharp, dull, dull, sharp, sharp, dull, sharp, dull, sharp, dull. Perfect. And he did get all of that correct, so all of that is intact. So now I'm gonna have you go ahead and stand up,
and then you're just gonna walk normally from here to there. Perfect, and then come back towards me. You're gonna walk heel to toe, heel to toe. That's your tandem walk, perfect. And that was all steady. Next, I'm gonna have you go ahead and close your eyes. And this is a negative Romberg test as he is not swaying or drifting in any way. Now go ahead and put your arms up, palms up. Perfect, and I don't see any pronator drift, which his wrist would go inwards. All right, well, I do believe that concludes our assessment. However, I did forget to talk about his vitals at the beginning. So his vitals were, and you can take a seat if you'd like. Vitals were 120/80, blood pressure, heart rate is 70, respirations were 16, and O2 sats were 98. What is your height, Abel?
I'm 5'11".
Perfect, and your weight?
150.
Okay, and I believe that puts us at like a BMI of 19-ish. But yeah, thank you.